So you were just prescribed an antipsychotic medication for whatever the reason, major depressive disorder, bipolar, sleep, anxiety, and you were told about tardive dyskinesia, but now you're wondering what is the actual risk of developing that? And I'm going to answer that exact question in this video. And by the end of this video, you'll have enough knowledge to make an educated decision regarding your mental health care. Let's start off with what tardive dyskinesia is. It's a potentially permanent involuntary movement disorder. And what does this look like? Well, involuntary movements of the face, mouth, tongue, jaw are the most common, but you can even get it in the trunk or the extremities. Well, what causes tardive dyskinesia? Well, dopamine blocking medications cause this. Second generation antipsychotics and first generation antipsychotics are examples. First generation antipsychotics block dopamine more and they don't have any actions on serotonin, so they actually have the highest risk. The good news is we don't use those much nowadays. But we do use a lot of second generation antipsychotics, SGAs. Let's go through these. Aripiprazole, brexpiprazole, cariprazine, lurazidone, lumateperone, olanzapine, samidorphan, polyperidone, risperidone, and ziprasidone. I know you've heard of some of these. Well, what are second generation antipsychotics used for? Many things. Bipolar disorder, unipolar depression, also known as major depressive disorder or just depression, schizophrenia and psychosis, OCD, PTSD, autism, anger and irritability in children and adults, and a lot more. And you might be thinking, well, I'm not psychotic and I don't have schizophrenia, so what does this have to do with me? Well, it's actually a common misconception, and second generation antipsychotics do a lot more than just block dopamine. Let's go over Seroquel, for example, and go over the mechanism of action. So first of all, it's FDA approved for major depressive disorder, mania, bipolar depression, and schizophrenia. It blocks serotonin receptors. 5-HT means serotonin, so 5-HT2A, 5-HT2C, 5-HT7. It also blocks H1, which is a histamine receptor, alpha-1, adrenergic, and alpha-2 adrenergic, and muscarinic cholinergic receptors. And it also works as a norepinephrine reuptake inhibitor. So you see here, it does a lot more than just block D2, and that's one of its mechanisms as well. Blocking D2, blocking dopamine 2. You might be wondering which of quetiapine's effects has antidepressant effects. Well, blocking 5-HT7, Trintellix does this, mirtazapine does this, Prozac does this. These are all common popular antidepressants. It also blocks 5-HT2A. Mirtazapine does this as well. And it's a partial agonist at 5-HT1A. Buspirone does this, also known as Buspar, an anti-anxiety medication. And it also works as a norepinephrine reuptake inhibitor. Effexor does this, and so does Cymbalta. Now let's get into the risks. What are the actual numbers? What are the actual risks of developing tardive dyskinesia if you take a second generation antipsychotic? So the overall risk is a 4.2% yearly risk of developing tardive dyskinesia with second generation antipsychotic use, SGA. In people a bit older, the risk increases to 5 to 7% per year. First generation antipsychotics like haloperidol, also known as Haldol, which we discussed earlier, have a higher risk, 5.5% yearly risk, 25% higher than second generation antipsychotics. Putting this into a 10-year perspective, second generation antipsychotics, after 10 years, you have a 42% risk. And first generation antipsychotics, put into perspective, 10-year risk is 55%. So half of people will develop tardive dyskinesia. But it's not quite that simple. There are many factors that contribute to the risk, making it more risky or making it less risky. The first factor let's consider is which second generation antipsychotic you use. Some of them actually have low to no risk of tardive dyskinesia. Pimavanserin has no risk, clozapine, no risk. Low risk would be quetiapine, which we mentioned earlier, and lumateperone, although lumateperone is a newer medication, so there's a bit less data to show. The ones in the middle with intermediate risk include aripiprazole, brexpiprazole, and cariprazine, as well as iloperidone, olanzapine, and ziprasidone. And the ones with the highest risk are paliperidone, risperidone, lurazidone, and azenapine. The risk also depends on the dose used. The higher the dose, the higher the risk. Also how long it's used. The longer it's being used for, the greater risk you'll have. Older people have increased risk, females, and also early occurrence of drug-induced movement disorders. Dystonia is where your muscles get frozen in a certain position. Parkinsonism is where dopamine gets blocked too much and everything slows down. And akathisia, it's kind of the opposite. It's an internal severe restlessness. Some comorbidities actually increase the risk as well. Psychotic disorders, intellectual disability, mood disorders, alcohol and substance use disorders, dementia, and even a medical disorder, diabetes, as well as prior electroconvulsive therapy. All right, now we know the risks, but how do we catch this early? Well, we need to understand it a little bit. Tardive dyskinesia only happens after about 3 months of starting a second-generation antipsychotic. That would be typical, or only 1 month in people a bit older, over 55. You yourself want to look for abnormal movements and let your family members know so they can look as well, because sometimes you might not notice them. Of course, your medical provider will ask about tardive dyskinesia at every visit, and something called the AIMS test, the Abnormal Involuntary Movement Scale Test, will be done every 6 months if high risk or yearly if low risk. Well, what do you need to know about what happens if you get tardive dyskinesia? Well, it goes away in about 1/3 of people within 3 months of stopping the drug. Most people gradually improve over a few years, and tardive dyskinesia may initially actually get worse right after stopping the medication. And remember, catching tardive dyskinesia early gives a better prognosis, meaning you'll do better for recovery. Well, if unfortunately you're one of the people who gets tardive dyskinesia, what kind of treatments exist? Well, first of all, we want to stop the antipsychotic that's causing the tardive dyskinesia by blocking dopamine, and we want to stop any other medicines that might make things worse, like anticholinergics and other medications that make TD worse. Anticholinergics, like Benadryl, is an anticholinergic. And there are actually some medication treatment options. There are some FDA-approved first-line treatment options, deutetrabenazine and valbenazine. They work by blocking VMAT2, which in turn decreases dopamine in the motor striatum, part of the brain that controls movement. We want to decrease dopamine there because now, since you have tardive dyskinesia, even normal amounts of dopamine are causing these abnormal movements because the neurons are upregulated, and all that means is they become hypersensitive. There are some second-line treatment options, clonazepam, which is a benzodiazepine, as well as ginkgo biloba, which is a natural supplement. And third line, amantadine can be considered as well. And now you know all about tardive dyskinesia, but did you know there are actually 4 other must-know side effects to antidepressant medications? So head over to this video next to stay informed.